How does speech therapy help dysarthria? Imagine trying to speak clearly after a stroke or a brain tumor has affected your brain. It can be frustrating when your words don't come out the way you want. Speech therapy is here to help improve that. Dysarthria is a motor speech disorder caused by damage to the parts of the brain that control muscles used for talking. This damage can weaken or impair muscles involved in breathing, voice production, movement of the lips and tongue, and the rhythm of speech. Speech therapy works by targeting these specific areas to help make speech clearer and more natural. Therapists use two main approaches. The first is restorative therapy, which aims to improve the function of the muscles and speech systems. This involves exercises that strengthen muscles, improve coordination, and give better control over speech movements. For example, articulation exercises help make consonants and vowels more precise, while breathing exercises support better breath control for speaking. Voice exercises can help improve the loudness and quality of the voice, and rate control techniques help slow down speech to make it easier to understand. The second approach is compensatory strategies. These are techniques that help communicate effectively even if some speech difficulties remains. This might include teaching alternative ways to communicate, such as using gestures or writing. It also involves training communication partners to better understand the person speaking, which can make conversations smoother and less frustrating. Speech therapy is based on principles of motor learning and neuroplasticity, which means the brain can adapt and recover functions with practice. Therapists design personalized practice routines that include repetition, feedback, and appropriate intensity to help patients learn and retain new speech patterns. Starting therapy early is especially helpful because the brain is more adaptable during the initial stages of recovery. In the context of brain cancer and brain health, speech therapy plays a vital role. Tumors or treatments like surgery or radiation can damage brain areas that control speech muscles. Therapy helps patients regain or maintain their ability to communicate, which is essential for emotional well-being and daily life. Recent advances include digital tools and smartphone-based programs that support speech therapy outside of traditional sessions. These tools can improve speech clarity and help reduce the severity of dysarthria, especially after strokes or neurological injuries. They also make therapy more accessible and easier to stick with. Overall, speech therapy for dysarthria is a personalized, evidence-based approach that helps individuals communicate better. It addresses specific speech challenges and supports participation in everyday activities. If you or someone you know is dealing with speech difficulties due to neurological conditions, consulting a qualified speech-language pathologist is the best step. They can develop a tailored plan that fits individual needs and promotes the best possible outcomes for brain health and communication.